Before you and I proceed, I would like to share 3 incredible, remarkable case studies that are presented in the following research. The case studies were in reference to dietary changes that had the appearance, at least in observation, of a reversal of many disease symptoms in regard to lupus or potentially other autoimmune diseases. Now, before we proceed, keep in mind these are case studies. It's not an official randomized controlled trial like we'd like to see. So further research needs to be done. So if making any suggestive changes in regard to your own personal life, please work with your medical professional. But without further ado, let's get right into the research as follows, because it is quite fascinating. To proceed, research case series presents food as medicine as a potential treatment for lupus and other autoimmune diseases. You're going to see RRP throughout. That's Rapid Recovery Program, and that is an understatement. To proceed, a new research case series published in Frontiers in Nutrition presents food as medicine as a potential treatment for autoimmune diseases, describing 3 patients with chronic autoimmune disease who showed remarkable improvement after following a predominantly raw dietary pattern high in cruciferous vegetables and omega-3 fatty acids. Let us proceed, because it's a little bit more disciplined as it appears in the first paragraph. The research focused on 3 women with systemic lupus erythematosus and Sjögren's syndrome who adopted a nutrition protocol that emphasized leafy greens, cruciferous vegetables, flax or chia seed for omega-3, polyunsaturated fatty acids, and water, and included predominantly raw foods. All 3 women reported that nearly all their symptoms of both diseases resolved after just 4 weeks of making the dietary changes. I'm going to delve into that a little more detail with the following charts and graphs. To proceed, furthermore, all 3 patients have remained symptom-free, with 2 of them reporting no symptoms for more than 6 years without recent medication use. The third case was actually they started the Rapid Recovery Program in 2022, so 6 years hasn't quite passed yet, and that we shall now review. Let's look at the diet. Don't worry about it. If you don't have 4K rendered, I'll have a little larger chart so you can look at this particular diet at the end of the video. All right, this is the diet. Below that small boxes down there is the outcomes in regard to these 3 cases. Case 1, case 2, case 3. Now keep in mind, a case study is not a randomized controlled double-blind study. So it is just the beginning of the questioning process. To proceed, look at the diet. Look at the vitamin B12, look at the salt recommendations per day, look at the vitamin D, and also too, when you see 16 ounces, as you read down the footnotes, they like to do like a 64-ounce green smoothie. So there was some option and changes there that an individual could take into account. Then, you have initial rapid recovery reversal phase. That's their words. Then you have the maintenance phase after that. So now we're turning back to a traditional Western diet. They're eating pretty much a diet that you would say before the 1900s. To proceed. Now keep in mind, I'll come back to this in a second. Let's look at the cases so you get an idea of the time frame, which is important. The time frame is as follows. You see the symptom profile, please forgive me. Case 1, case 2, case 3. Let that sink in for a couple seconds. You can see the years and the progression throughout their lives in regard to these particular ailments. All right, now you go down to the bottom. You see case 3. Now, case 3 may be a little perplexing because you're not seeing the Rapid Recovery Program results as follows. But look at the year it began. So let's look at the testimonial from the test case recipient. And so we're going to start with case 3. And there you have it. You see case 3? I highlighted the conclusion of their statement, and it is quite enlightening. Let that sink in for a second. Now, what about case 1 and case 2? Pretty much more of the same remarkable outcome in recovery. Case 1, case 2. Pause it for a second. read through it. And then again, if anything you miss, the DOI citation is always listed so you can follow it to the actual full study itself. So that is pretty amazing. Now, let's get to the conclusion, which the conclusion is best said in the abstract, the top part of the research as follows. In conclusion, systemic lupus erythematosus and Sjögren syndrome are chronic immune diseases. This is going to reiterate and be repetitive for a lot of individuals, but it gets better. Symptoms of SLE can vary widely, but often include fatigue, pain, photosensitivity, and in some cases, nephritis. Sjögren syndrome is frequently characterized by extreme dry eye and mouth resulting from damage to moisture-producing glands, and is often present in combination with SLE. While the health benefits of plant-based diets have been well established, with respect to weight and cardiometabolic outcomes, less research is available to support, again, to reiterate, less research is available to support. This is the beginning. These are the case studies, it's the observation. Now further studies need to be done to validate these incredible results. Basically, cardiometabolic outcomes, less research is available to support the role of diet in treatment and management of autoimmune diseases. This case series presents 3 women with SLE and SS who adopted a nutrition protocol to reverse symptoms of autoimmune disease. The protocol emphasizes leafy greens, cruciferous vegetables, omega-3 polyunsaturated fatty acids, and water. It includes predominantly raw foods. The 3 patients reported dramatic improvements in physical symptoms, with nearly all symptoms of their lupus and Sjögren's resolving after 4 weeks. Years of battling with these ailments to have resolution mostly after 4 weeks is, again, without using the word too often, remarkable. Resolving after 4 weeks or less of adhering to the protocol. All 3 patients have remained symptom-free. 2 of them remained symptom-free for 6+ years with no recent medication use. And of course, the 3rd patient started the diet in 2022. Keep in mind, patients and practitioners should be made aware of the promising possibility of food as medicine in the treatment of SLE and SS, systemic lupus erythematosus, and Sjögren syndrome. Future research should explore whether dietary changes may be a potential treatment strategy for individuals suffering from severe symptoms and poor quality of life due to systemic lupus erythematosus and Sjögren's syndrome. That is just incredible outcome altogether. Albeit case studies, it is the beginning of the questioning process. Why? How? How long can this maintain? Does it work for most people, all people, some people, or just the 3 in these particular case studies? Future research will have to resolve those questions. And keep in mind too, I'm going to keep the diet up right there and make it a little bigger in a second, but you have to give incredible, let's go over the full research study. You have to give credit to the researchers for at least looking into this, documenting it, and then bring it to the attention of the public for you and I to share. Gratitude, gratitude, gratitude. I am humble you watch and look forward to see what you and I share next week. Again, I don't know until a few days out before we actually begin to look at the research and delve into what we can report on or you may be highly interested in. But to proceed as follows, gratitude, thank you, and I'll see you all next time. And I'm going to leave the diet up in big picture so you can see and record as necessary to share with the medical professional. And as always, look forward to seeing you all next week. Catch you next time. Bye.